Welcome to the video of what is all about upper limb nerve entrapments. If you know exactly what entrapment you have, go to timestamps below, but if you don't have a clue, then check the whole video through. Do you feel that your hand is going numb in the area of thumb, index finger and middle finger, and you are wondering what is happening? If you suffer from this kind of peripheral nerve problem, typical symptoms include tingling, numbness and prickling sensations, electric shock-like sensations in the hand. This condition is absolute number one issue when it comes to upper limb nerve entrapment. Let's start with the anatomy. Why, you may ask? Well, understanding the nerve pathway and any structures that might put pressure on it can help us to grasp the overall picture and possibly contribute to the upper limb symptoms. Nerve starts its journey from the 6th, 7th, 8th cervical vertebrae and the first thoracic vertebrae. Its role is to control the movement of the forearm, wrist, hand and fingers, as well to provide sensory information to the visible areas. The nerve travels from our cervical and thoracic structures downwards towards the armpit. From there, it continues along the inner surface of the upper arm to elbow area. In the forearm, the nerve descends moderately towards the wrist area, passing underneath transverse tendon bundle, and it's branching out in the area of thumb, index finger and middle finger. If you don't have any injuries in the upper arm, it's essential to carefully examine the structures in the inner side of the forearm. You find extremely tender structures, or if pressing of them reproduce your familiar symptoms into the hand, then it's advisable to relax these areas with the light massage. If your wrist mobility is severely limited, gentle stretching might be helpful as well. Here is a handy stretch to easily stretch both upper limbs. Remember not to experience a pain during the movement. If you do, you are stretching the structure too aggressively. The intensity of the external rotation will affect the stretch. To test difference in nerve gliding between the affected and unaffected side, do the following. Gently press the shoulder down. Abduct the upper arm to 90 degrees. Perform external rotation towards the ceiling with the upper arm. Rotate the forearm into external rotation with the palm facing to the head. Bend the wrist downwards and try to keep your fingers straight. Extend the elbow until the symptoms are provocated. In this position, you can experiment with the side bending of the head towards the hand to see if it affects upper limb symptoms. In some cases, side bending away from the hand may provocate the symptoms. Additionally, you can explore how different wrist position can affect the sensations in the arm. After testing both sides, if there is a clear asymmetry present, the goal should be to achieve the symmetry in nerve gliding, meaning that both nerves should slide in the same manner. After treatment and the stretches, you can retest and see how the asymmetry has improved. For the light nerve gliding, follow these steps. Imagine the nerve movement within the structures with this band. When you move your hand in the stretched position at side bending to the head towards the hand. This is relatively safe, but if you need more aggressive stretch, take the nerve to tightened position and push through with the wrist, elbow or head for a minute. Focus on the movement that clearly intensify your familiar symptoms. If any of those movements doesn't reproduce your typical symptoms, then avoid doing them. Perform nerve gliding in few minute sessions, spreading them through the day, 3 or 4 sets. Additionally, if needed, apply soft tissue management for the duration of your favorite song and follow up with the gentle pain-free stretchings if there is a significant wrist restriction. Are you experiencing issues in your little and ring finger, and you are wondering how to relieve this discomfort? The nerve responsible for this finger area is the ulnar nerve, and it originates from the 8th cervical level and the first thoracic nerve root. From the neck, it travels to the area under the armpit, and then it goes down in the surface of the upper arm, passing behind the medial epicondyle in its own groove, and finally reaching the wrist area. In the wrist region, it innervates the bending of the little finger and certain muscles in the hand.
If you feel tenderness above or below the medial epicondyle and light pressure in these areas cause familiar symptoms to fingertips, you should try to relax these areas with the gentle massage. If there is a restricted movement in the wrist, light stretching may be helpful. You can easily stretch these structures by pulling your little finger and ring finger gently towards your arm while keeping the upper limb straight. During the stretches, there should not be pain, and if you experience any, you are applying too much force. To test the difference in the nerve mobility between the affected and unaffected side, do the following. Gently press the shoulder downwards. Abduct the arm to 90 degrees angle. Rotate the forearm inwards. Bend the finger and the wrist. Perform external rotation of the arm. Move the little finger and ring finger towards the ear. In this position, you can assess if the tilting of your head towards the hand affects the upper limb symptoms. In some cases, bending the head away from the hand may provocate the symptoms. Additionally, you can see how the wrist flexion position affects the feelings in hand. If you find clear difference between the both sides, then you should aim for the symmetry in the nerve mobility, meaning the both nerves should slide similarly. After the treatment and stretching, you can retest to see if you've improved asymmetry. If you want to perform light nerve gliding, here's how you can do it. In this demonstration, the tube is demonstrating the nerve movement in the structures. Assume the nerve testing position, and as you move your fingers towards the ear, simultaneously tilt your head towards the hand. This is relatively safe, and if you need more intense stretch, find the position where the nerve is taut and pump it through the wrist, elbow, or neck for a minute. Focus on the movements that clearly amplify your typical symptoms. If any of these movements doesn't affect your symptoms, you don't need to do them. I recommend doing the nerve glidings in sessions within a few minutes, spreading them through the day 3 or 4 times. Additionally, if necessary, perform soft tissue manipulation for the duration of your favorite song and follow it with the pain-free stretching if there is a significant restriction in wrist. Is the hand numb from the more distal part of the upper arm and from the back of the forearm and also from the palm side between the thumb and index finger. This condition is the third most common upper limb nerve entrapment. The radial nerve originates from the 5th, 6th, 7th and 8th cervical nerve root as well as the first thoracic vertebra. From the armpit, it wraps around the upper arm, moving to the radial side of the forearm, and it continues towards the fingertips. Its sensory innervation indicates by pink areas in this image, mainly supplying the triceps, forearm, and hand extensor muscle. If you don't have any upper limb injuries on the background, then it's crucial to examine the structures on the outside of the forearm. If you find extremely tender structures or pressing of them causes familiar symptoms to upper limb area, then it's necessary to relax these areas through the light massage. If the wrist mobility is severely limited, gentle stretching may be beneficial. Here's a useful stretch for the muscles on the back of the forearm. During the stretching, it's important not to experience pain. If you do, you are most likely doing it too fast. If you want to test the difference in nerve gliding between the affected and unaffected side, do the following. Gently push the shoulder down. Abduct the arm about 10 degrees from the body. Bend the elbow to 90 degrees. Internally rotate the palm. Flex the fingers, begging to strengthen the elbow until the symptoms are provoked. In this position, you can explore the effect of the tilting of the head towards the hand on the upper limb symptoms. In some cases, tilting of the head away from the hand may worsen the symptoms. Additionally, you can test how different wrist flexion position affect the sensations in the hand. After testing both sides, if there is a clear difference, then you should aim for the symmetry in nerve gliding, meaning both nerves should glide similarly. After treatment and stretching, you can retest the feelings before and afterwards of those. If you want to perform light nerve gliding, here's how you can do it. Demonstration of the nerve movement can be provided with this tool. As I flex my hand into the stretched position, I tilt my head towards the arm. This is relatively safe, and if you need to increase the stretch more aggressively, then take the nerve in the tightened position and gently pump through the wrist, elbow and head for the mirror. Focus on the movements that clearly intensify your familiar symptoms. If any of these movements doesn't affect your typical symptoms, then I would be doing those. I would be performing the nerve gliding 1 to 2 minutes intervals sprinkled through the day, for the 3 or 4 sets per day. Additionally, if you need soft tissue treatment, do it for the duration of one good song on the background. If your wrist is really restricted, then do also pain-free stretches for one good song. If these instructions don't ease your symptoms, then I would be recommending seeking advice from the doctor or skilled physiotherapist.
Thank you for your time, and next, click this one. It's all about sciatic nerve.